Okay, so today we're going to be doing a knee trigger. I'm going to be doing an AP, an oblique with medial rotation, a lateral. I'm also going to be doing a Beclaire and the Setagas. Okay, so I am detented to my table bucky. I have an IR in the table bucky, and I'm at 40 inches. So I'm going to go ahead and call my patient back. So Montalvo. Hi, my name is Jay Hyde. I'm from the radiology department. We're going to be taking some x-rays of your knee. Can I get your full name and date of birth?
Anne Marie Montalvo.
Okay, and your date of birth?
Oh, 5/15/80.
And then what's going on today? Why are you having the x-rays done?
My right leg, I fell off the ladder.
You fell off the ladder. How long ago did you fall off?
About a week ago.
Okay, and are you having any pain right now?
No.
Okay. Is there any chance of pregnancy?
No.
Okay. So if I can have you get onto the table.
Okay. Do you need me laying down?
Can you lay down, please? Okay, so and then I'm going to go ahead and show my patient. And then for my AP, my central ray is going to be perpendicular. The angulation varies depending on the patient's size. So for her, I'm going to have it perpendicular. And I'm going to come in half an inch of the apex of the patella. And I'm going to go ahead and put my marker there. And a technique that I would use would probably be about 80 at about 10. So I'm going to go ahead and take the x-ray. So x-ray, come back, and I would take my IR out, and then I would put a new one in. And this time I'm going to have my patient rotate their leg medially, 45 degrees. And then I have the same central ray, half an inch at the apex of the patella. I'll put my right marker. And then I'll go ahead and do my x-ray. So x-ray, I'll come back, and I'll go ahead and change my IR, put a new one in. Okay, so this time I would ask my patient to roll onto her right side. And so she would bring the unaffected leg over, and then she would flex her right leg 20 to 30 degrees. And at this time I would angle my tube 5 to 7 degrees to phallus. And my central ray will come in at the epicondyle. So I put a new IR in, so then I'm going to do the exposure. X-ray. And then I would read my IR. Okay, so now I'm going to be doing the Beclaire method. I'm going to have my patient flex her knee 60 degrees. My central ray is going to come in at the apex of the patella, half an inch below that, and my tube is going to be angled so that it is perpendicular to the long axis of the leg. have my right marker. And the technique that I would use for this would be 70 at 5. I'm going to go ahead and take the exposure. X-ray. Come and then go and read my IR. Okay, so now I'm going to be doing the Setagas. So I'm going to ask my patient to sit up. You can go ahead and sit up. And then I'm going to flex my patient's knee. And then are you able to hold this?
Sure.
Are you able to hold it while you're lying down? No? Okay. So
Probably
just
not.
sit. Okay.
This is the farthest.
And then, actually, can I have you come all the way down to the table? Okay, right there is good. There. And I'm going to have a tube angle about 15 to 20 depending on my leg flexion. And my central ray is going to come in at the patellofemoral joint. And then I'll go ahead and put my right marker. And the technique that I would use for this would be 70 at 2. Go ahead and take my exposure, X-ray, and then I'll go ahead and run my IR. Okay, so for my knee trigger, I did an AP, I did a lateral, and then I did an oblique with medial rotation. I also did Beclaire and the Setagas methods. So for my AP knee, your central ray would come in 1 inch inferior to the patellar apex, and you would angle just depending on the centimeter of your patient. So my criteria would be the knee would be fully extended if the patient's condition permits. You want your knee without rotation, femoral condyle symmetric, and tibia intercondylar eminence centered. You want slight imposition of the fibular head and the tibia. The patella is completely superimposed on the femur, and you want open femoral tibial joint spaces. So that is my AP knee, and then so we would go to my lateral projection, and for that one you would want your central ray to be 1 inch distal to the medial epicondyles, and your leg should be angled, or I'm sorry, your central ray should be angled 5 to 7 degrees cephalad. And you want to flex your knee 20 to 30 degrees. You would want the fibular head and the tibia slightly superimposed. You want your patella in a lateral profile, an open patellofemoral joint space, open joint space between the femoral condyles and the tibia. So that is my lateral projection. And then we would go down to my oblique with medial rotation. And for that one, you would want, again, your central ray to be 1 inch inferior from the patellar apex. And you would also angle your tube depending on the centimeter of the patient. You would want tibia and fibular separated at their proximal articulation. You want to see the posterior tibia, the lateral condyles of the femur and tibia, both tibial plateaus, margins of the patella projected slightly beyond the medial side of the femoral condyles, and you would want an open knee joint. So then my next projection is going to be the Beclaire, and for this one, you would want your central ray to be perpendicular to the long axis of the lower leg, and it's going to enter the knee joint 1/2 inch below the patellar apex, and you would want open intercondylar fossa, the posterior surface of the femoral condyles. You want the intercondylar eminence and knee joint space, and no superimposition of the fossa by the apex of the patella, and no rotation as demonstrated by the slight tibial-fibular overlap. And that would be all. You would also want your leg to be flexed 60 degrees. And then so the next one that we would do would be the Settegas. And for this one, your central ray would be perpendicular to the joint space between the patella and the femoral condyles. You would want to see the patella in profile, the femoral condyles and intercondylar sulcus, and open patellofemoral articulation. And that is all for my knee trigger.